Hello, I'm Dr.Udai Prakash. I'm an orthopedic surgeon practicing at Udai Omni Hospital. I specialize in joint replacement surgery, complex primary and revision hip and knee replacements. Specialize in sports injuries of the knee, and I do a lot of arthroscopic surgery of the knee, and of course the routine trauma, fractures that come into our emergencies. My training was essentially in Britain for about 10 years, following which I was a consultant in one of the teaching hospitals over there. And I was also an honorary associate professor at Warwick University, and I was in charge of training registrars and medical students. Having worked as a professional in Britain for over 20 years, I decided to come back to India and take charge of the hospital that my father had set up many years ago. And we now work in a very modern setup, which has a 24/7 emergency care and intensive care, and we practice very high standards of orthopedic care. I've been asked to share my thoughts on setting standards and benchmarks for orthopedic care in India. I think this is a very sensitive question, and because the standards vary across the country, and even within a small city, you'll find that the standards of care vary. I personally feel that there's a lot to learn from the West, and I think the Indian medical education is basically continuing from practices set back by the British, and we haven't really changed much over the years. Medical training has to change right from the beginning. There should be national standards set by a national body, which should not be politically motivated or have anything to do with the central government. It should be completely set by doctors. The standards should be set by doctors, and the doctors should be monitoring the training of medical students and postgraduate training as well. Now, there are many specialities in medicine, and I, for one, am an orthopedic surgeon. Maybe I have some issues with the training of orthopedics in our country. And I often discuss this at meetings and with my colleagues that I think we should have national standards for all orthopedic training in this country, and there should be a common sort of a book through which we practice and set standards and monitor standards. By and large, India is a very big country, so it might be difficult to start this immediately, but the thought process should start now. And every postgraduate student should be closely monitored, not only by the institution where he's training, but also by a national body. Of course, there are examinations, and these people have to pass their exams. But I feel the standard of a postgraduate orthopedic doctor is pretty poor to start with. They need extensive training outside their hospitals. And generally, by and large, the training is in big private hospitals rather than government hospitals. Now, I know that government hospitals are coming up, and there are some very good hospitals like the Postgraduate Institute in Chandigarh and Vellore and AIIMS in Delhi. And so there are scattered big orthopedic, not only orthopedic, but government hospitals that offer very high standards of medical care. But I think by and large, the orthopedic training in India is fairly poor, I think, personally. So that's why many of these bright people need further training after they finish their MS, and really take quite a few years before they come to a standards where they can practice independently. Unfortunately, private practice is always basically private practice in India is not of very healthy standards. I think many people are often misled by depending upon who and where they go and see, and I think this is not particularly something that we should be talking openly about. But until we talk openly and have a debate, nobody is going to come to the patient's rescue. So I think it's very important that orthopedic surgeons follow strict standards of practice, ethical standards, and these things should be monitored by a national body, not only amongst postgraduates, but also amongst doctors. And so something like revalidation for orthopedic surgeons should be something that we should be considering in the long term. When it comes to subspecialties within orthopedics like joint replacements, I think some great strides have been made, and I can talk about this because I do go to meetings, and we are trying hard to set standards and encouraging surgeons who practice independently to start registering on our national database to follow their patients who've had joint replacement. So all joint replacements in India should be now on a registry, and these patients should be followed up regularly and their outcomes monitored. I will stop here for now because I think I've set the tone and perhaps a debate. And really, I think there's a long way to go, but I'm sure we will get there. Thank you.